Hi Aaron, welcome to today's meeting in regards to the evaluation of the recent rehabilitation programme you have been engaging in for the rupture to your bicep femoris in your left leg. As you know, over the past 10 months you have been undergoing a rehab programme upon surgery after you ruptured your left bicep femoris during a football match, giving me feedback to your recovery progress and progress throughout. This meeting will inform and evaluate how it went in regards to the benefits of engaging the programme, your progress and the future recommendations to aid your injury. First of all, I will start by explaining the benefits of engaging in a rehabilitation programme. According to Comfort and Abrahamson 2010, the benefit of engaging in a rehabilitation programme is that it allows for a faster recovery and allows you to restore full function in order to return to sport as soon as possible. A rehab programme initially benefits you in helping to reduce any pain and inflammation from your injury, which is much required in the intermediate aftermath of an injury due to the substantial pain in which you have been in. Engaging in a rehabilitation programme also has the benefit of strengthening weakened muscle groups and maintaining cardiovascular fitness while you are out of sport. Ellen Becker, DiCarlo and De Rosa 2009. If you are not to engage in a rehabilitation programme, muscle groups would become extremely weak and your cardiovascular fitness would deteriorate substantially, especially for how long you are out for, and would make it harder to return to sport when you are recovered from the injury. Rehabilitation programmes also help to improve your flexibility and coordination to help you minimise the risk of future injuries, whereas not engaging in one when injured causes the joints and muscles to stiffen with lack of use and strengthening, which may lead to further injury. Rehabilitation programmes also benefit you by breaking down scar tissue and promoting the healing of tissues, stretching muscles and ligaments to increase range of movement, relieving any muscle spasms or stiffness, increasing lubrication and nutrition of injured and unaffected joints, removing chemicals in the injured area that are causing pain, and build up weakened muscles to regain full function. Progressive Physiotherapy 2015. I am now going to evaluate your progress throughout the rehab programme. At each phase it was indicated that you could not progress on to the next phase without reaching the target set in order to avoid any further injury occurring and to avoid a relapse. To begin with, in the initial phase I set the targets of pain and inflammation to be decreased, and they both had decreased by the first 7 days, where rest and medication to reduce this pain and inflammation were the only things required. For the next 2 weeks, exercises were set, consisted of ones which were with the aim of improving range of motion, improving knee and hip joint proprioception, and regaining quadriceps and hamstring control. By the 3rd week, we were both happy with these targets being well on their way and reached. For the last 2 weeks of the initial phase, extra exercises were added in order to achieve normal gait without crutches, in which you had achieved by the 5-week mark, so advancement onto the next phase was accepted. Cryotherapy and electrotherapy have both been included during this phase, in which you was happy it was helping your progress. In the first few weeks of the intermediate phase, we had exercises were added to meet the targets of full range of motion being obtained, improving strength in the lower extremity, further improving the knee and hip joint proprioception, and improving flexibility. Here you are able to engage in all the exercises but felt a little bit of pain to the injured side. However, this pain did not result in any further swelling to the injury, so I concluded no relapse or setback had occurred. By week 8, lower extremity muscles were becoming stronger and knee and hip joint proprioception was good. Flexibility had improved, but full range of motion was still not reached. Sorry about that. Flexibility had become improved, but full range of motion was still not reached. At week 8, extra exercises were added to further improve strength in the lower extremity, but now also to begin controlling forces during walking. You had no problem with walking in linear directions and no limp or difference in technique was noticeable. However, the pace was slow. At week 12, running was introduced, but we had a setback here and adjustments had to be made. At week 12, you were unable to begin running due to the pain it was causing to your injury. We decided to put the running back 2 weeks and did 2 weeks of treadmill walking and linear movements walking rather than running. Here we also increased the amount of contrast bathing we were doing and was ensuring it was kept a regular thing. Once again, during this phase, contrast bathing, electrotherapy were performed with no pain or discomfort. However, as stated before, contrast bathing was increased at week 12 when the pain had become present again. At week 14, where we targeted to move on to the next phase, I was not happy that you had completed every target and specifically not reached the begin running target. As previously stated, walking was utilised instead, and running began at week 14 for the next 2 weeks, and by week 16 I was happy with you moving on to the next phase due to no pain now being present when running. In the first 4 weeks of the advanced phase, exercises were included which had the target of improving strength, power and endurance without pain. Due to the resistance now being high, you mentioned how these exercises were having an effect on your muscles and how you were suffering with symptoms of delayed onset of muscle soreness, DOMS. Therefore, we ensured sports massage and contrast bathing was regularly used. By week 20, which was supposed to be 18, the DOMS was almost non-existent after exercises and improvements to your strength, power and endurance were noticeable. At week 20, we were now ready to progress and add extra exercises which were sport specific to reach the target of gradually preparing you for a return to sport. Here, it was noticeable that your normal running pattern and no pain when running was achieved, therefore this target had also been reached. At week 28, extra sport specific exercises were added for the next 4 weeks. By week 32, I was happy with you being ready to advance onto the return to sport phase. In the first 8 weeks of the return to sport phase, sport specific exercises were implemented onto the programme with the aim of being able to achieve no pain or swelling after training, to achieve good results in functional tests, and to achieve good results in functional sport-specific tests. By the end of the 8 weeks and the 40-week mark, you achieved good results in both sets and felt no pain or swelling, signalling you are ready to begin competition-based training and practice games. For the first 2 weeks of this game time, it was set at 60 minutes. During these 2 weeks, you played 3 games in all for 60 minutes and came out with no pain or swelling or setbacks. After these 2 weeks, a further 2 weeks of game time was engaged in, but this time for 90 minutes of game time. Here you played 2 sport-specific games and completed both games with no pain or swelling to the injured side. Sports massage was performed after each game, where you also decided to use an ice bath post-match. Overall, your progress throughout the rehabilitation was extremely good, and you managed to basically stay on track throughout it all. The rehabilitation programme lasted 44 weeks, 2 weeks longer than targeted, but now you're fully fit and ready to get back into your team. To avoid future injury to the bicep femoris and to continue aiding recovery, it would be advised that flexibility in the hamstring and hip and knee joints was engaged in on a regular basis. This can be ensured by stretching and engaging in similar exercises in this programme. These include hip abduction, adduction and extension, leg extension and curl, and resistance band exercises such as knee flexion and lion leg curl. According to Kading and Borchers 2014, eccentric training can effectively improve lower limb muscular flexibility. Regularly engaging in this eccentric hamstring exercises, such as hamstring curls, leg extension and leg curls, will also help to improve flexibility of the hamstrings and hip and knee joints as well. It would also be advised that strengthening the hamstrings and hip and knee joints would be beneficial to help avoid reoccurrence of the injury. According to Ackland, Elliott and Bluefield 2009, strength training can reduce the risk of injury in several ways. This can be done by the weight training of the hamstrings with exercise such as leg curls and squats. Thank you for your time. The meeting is now over.